Cervical spine disc degeneration is a form of arthritis. Discs are located at each vertebra of the spinal column. The first 7 vertebrae at the top of the spinal column is the cervical spine. These vertebrae extend from the base of the skull to the upper back. The vertebrae are individual bones attached to each other by many small ligaments and facet joints. The spinal vertebrae surrounds and protects the spinal cord as it extends from the base of the brain through the spinal canal to the base of the spine. There is one large nerve root extending out of the spinal cord between each vertebra and both the right and left side. Vertebrae are shaped with hole or forearm to allow the nerve roots to pass freely and exit between each vertebra. Every muscle in the upper extremity is supplied by the nerve roots that travel down the arm. There are discs separating each vertebra of the spine. These discs help to separate the vertebrae to allow movement. They act like cushion between the vertebrae. They also help create space between each vertebrae through which each nerve root exits the spinal column. Each disc acts as shock absorbers between the vertebrae and adds to the flexibility to the spine. The cumulative effect of the micro traumas or injuries that occur in our lives can cause the fibers of the disc to become weak. These fibers on the outer part of the disc are called annular fibers. Inside the center of the disc is material called the nucleus pulposus. Abnormal biomechanics of the vertebrae can cause gradual wear and tear of the disc annular fibers. As the disc fibers weaken or get injured, a bulge of the disc can develop. In some cases, disc fibers rupture, allowing the nucleus pulposus material to protrude, creating a disc herniation. This protruding disc material can press on a nerve root, which can result in radiating pain, burning, numbness, and tingling in the upper back and arm. As the body ages, the boundary between the two parts of the disc becomes thin and the center of the disc becomes stiff and less gel-like. The loss of this gel-like structure in the disc has a major effect on the disc load-bearing ability. Most cases of disc degeneration involves poor posture of the head. When the head is protruded forward and in front of the body, it often results in cervical spine developing a reverse curve posture, an abnormal inward curvature of the spine. A normal cervical spine should have 60-degree arc in the neck with the head position above the shoulder. If the head bends forward in front of the shoulder, it causes excessive wear and tear on the disc in the neck. Quite often, disc degeneration combined with bone spur and wear and tear of the vertebrae occur in the same time. Once the disc has begun to degenerate, there is no reversing the process. Therefore, it is important to improve the alignment of the cervical vertebrae to prevent the advancement or worsening of the disc degeneration. Physiotherapy and yoga can help to reduce pain and promote a healthy posture.